White blood cells. Previously, we discussed about the red blood cells count, and blood cellular components. Now we will discuss the white blood cells that are observed or seen in between the platelets and the RBCs. What are white blood cells? Your blood is made up of red blood cells, white blood cells, plasma, and platelets. Your white blood cells account for only about 1% of your blood, but their impact is big. White blood cells are also called leukocytes. They protect you against illness and diseases. Think of white blood cells as your immunity cells. In a sense, they are always at war. They flow through your bloodstream to fight viruses, bacteria, and other foreign invaders that threaten your health when your body is in distress and a particular area is under attack. White blood cells rush in to help destroy the harmful substances and prevent illness. White blood cells are made in the bone marrow. They are stored in your blood and lymph tissues. Because some white blood cells called neutrophils have a short life, less than a day, your bone marrow is always making them. Types of WBCs. White blood cells are referred to as WBCs. Among your white blood cells are monocytes. They have a longer lifespan than many white blood cells and help to break down bacteria. Lymphocytes. They create antibodies to fight against bacteria, viruses, and other potentially harmful invaders. Neutrophils. Neutrophils kill and digest bacteria and fungi. They are the most numerous type of white blood cells and your first line of defense when infection strikes. These small cells seem to basophils. What are these basophils? These small cells seem to sound an alarm when infectious agents invade your blood. They secrete chemicals such as histamine, a marker of allergic disease, that help control the body's immune response. Eosinophils. They attack and kill parasites and cancer cells and help with the allergic responses. Problems affecting white blood cells. Your white blood cell count can be low for a number of reasons. This includes when someone is destroying the cells more quickly than the body can replenish them, or when the bone marrow stops making enough white blood cells to keep you healthy. When your white blood cell count is low, you are at great risk for any illness or infection, which can spiral into a serious health threat. Your healthcare provider can do a blood test to see whether your white blood cell count is normal. If your count is too low or too high, you may have a white blood cell disorder. A number of diseases and conditions may affect white blood cell levels. Weak immune system. This is often caused by illnesses such as HIV, AIDS, or by cancer treatment. Cancer treatments such as chemotherapy or radiation therapy can destroy white blood cells and leave you at risk for infection. A higher than normal white blood cell count usually means you have some type of infection. White blood cells are multiplying to destroy the bacteria or virus. Myelodysplastic syndrome. This condition causes abnormal production of blood cells. This includes white blood cells in the bone marrow. Cancer of blood. Cancers including leukemia and lymphoma can cause uncontrolled growth of an abnormal type of blood cell in the bone marrow. This results in a general increased risk for infection or serious bleeding. Myeloproliferative disorder. This disorder refers to various conditions that trigger the excessive production of immature blood cells. This can result in an unhealthy balance of all types of blood cells in the bone marrow and too many or too few white blood cells in the blood. Medicines include some medicines can raise or lower the body's white blood cell count. Conditions such as extreme physical stress caused by an injury or emotional stress can also trigger white blood cell levels. So can inflammation, labor or the end of pregnancy, smoking, or even extreme exercise. We have discussed today the types of all these white blood cells in our blood. Total are monocytes, lymphocytes, neutrophils, basophils, and eosinophils. Eosinophils are very rare in our blood. They are the number of count of eosinophil in our body is almost diminished. But in allergic reactions, like in asthmatic patients, you may find the raised eosinophil levels more than normal range. Basophils are 1 to 2 or 0 to 1 count. Normal count, you may check the normal counts of all these white blood cell types from the internet.